Hi, my name is Shifa, and this is my presentation on malnutrition. Too little, too much, the global food imbalance. Before we begin, here's a quick introduction about me. I'm from Frisco, Texas, and will be a senior at Reedy High School in the fall. I enjoy playing the piano, painting, and spending time with my friends and family. As far as activities go, I am actively involved in my school's debate program and host a chapter, and I'm also the chief editor of the Voice of Frisco, which is a student-led newspaper. Additionally, I'm the vice president of Nature's Nurturers, which is a nature-related volunteer club. In the future, I hope to pursue either pathology, public health, or psychology, and hope to become either a pathologist, epidemiologist, or psychiatrist. Now let's get into the presentation, starting with some background information. When most people think of malnutrition, they typically think of undernourishment. However, this is a big misconception. Malnutrition is a spectrum, ranging from undernutrition to overnutrition, and one commonly accepted metric to measure this is the body mass index, or BMI. The BMI is a metric that measures the ratio of someone's body fat to their height and their weight, and then it compares that number to others that are within the same gender and age cohort. The calculation for this is simple, being just weight in kilograms divided by height in meters squared. The image at the bottom of this slide shows the thresholds for each category in the BMI, and this chart on the right-hand side of the slide shows what percent of people across the world are estimated to be in each of these categories. We can see that about 14 to 28% of people are in the normal category, which indicates the nutritional burden that we have on our hands. Going into the geographical location for each of these conditions, we can see that undernutrition is primarily concentrated within Africa and South Asia, while overnutrition is primarily concentrated in the West, Europe, and Australia. With that in mind, approximately 149 million kids under the age of 5 are experiencing stunted growth. 45 million kids are experiencing wasted growth, and 2.5 billion adults are overweight, with 890 million of these adults being obese. All of this indicates that there is a pressing concern for malnutrition that needs to be addressed. But before we discuss how the field of public health is addressing malnutrition, let's better understand undernutrition and overnutrition. Starting with undernutrition. Stunting and wasting are two common forms of undernutrition. Stunting is defined as having a low height for your age, and wasting is defined as having a low weight for your height. Some characteristics of stunting include experiencing under 2 inches of growth each year after your second birthday, and having developmental delays, such as having trouble sitting or standing during early childhood. Wasting can be characterized by being incredibly thin and constantly experiencing fatigue. Some causes for these conditions include maternal undernutrition, meaning if your mother is undernourished during pregnancy, the child is also more likely to be undernourished after birth, and inadequate nutrition, which means that an individual is not consuming enough growth-promoting nutrients, such as zinc or calcium. Some effects for these conditions include lowered cognitive ability and lowered IQ, higher risk of developing diabetes and hypertension due to weakened and compromised immune systems, and lowered wages and economic productivity. In fact, a study showed that stunted individuals complete about 1.6 less years of schooling compared to other individuals, which can result in receiving a lower wage during adulthood. And unfortunately, these effects are intergenerational, meaning they can be passed along and can keep people in a cycle of being stunted or wasted. Here are some growth charts from the World Health Organization. On the left, we see the length for age chart from birth to 2 years old in girls, and on the right, we see weight for height for 2 to 5 year old girls. On the right-hand side of each of these charts, we can see the Z-scores, and undernutrition would be marked by a Z-score of -2 or lower. So this would define stunted growth, and this would define wasted growth. However, it is important to note that lack of access to food isn't the only reason why people are undernourished. Eating disorders are also a large contributor to undernourishment cases. Here's a graphic showing eating disorders in 2025 by country. This graphic specifically shows anorexia cases, and we can see that this is most common in the West and in Australia. Some causes and characteristics of anorexia nervosa can include body dysmorphia and cultural idealization, which can make individuals feel internalized pressure to look a certain way and to be thin. This can include, and it can also include, being afraid to gain weight. The effects of anorexia nervosa include cardiac issues, bone loss, which could lead to osteoporosis, and comorbid depression, anxiety, and OCD stemming from body dissatisfaction and body image issues. On the flip side, we can see binge eating disorder can contribute to overnutrition. Binge eating disorder is characterized by overeating in short intervals or episodes, and it can be a result of trauma or loss of control or low self-esteem. The effects of this are similar to anorexia nervosa, including an increased risk of chronic illness, comorbid depression, and social withdrawal, feeling guilt and shame. Continuing the conversation of overnutrition, we can see that some other causes include consuming an unbalanced diet, not having access to nutritious foods, and lack of physical activity. I'd also like to point out that sometimes people who earn lower incomes are more likely to become overnourished due to the fact that foods that are easier to afford and cheaper are oftentimes fast foods. Fast foods, while being more affordable, are calorically dense and nutritionally bare, meaning individuals that consume them regularly have a higher chance of becoming overweight or obese. The effects of this can include cardiac issues, development of type 2 diabetes, and drastically impacted mental health, as individuals with obesity are more likely and more prone to developing depression than individuals without it. Which brings me to current intervention. As of right now, we see many interventional programs for both undernutrition and overnutrition, including the community nutrition package in Nepal and comprehensive nutrition program in Malawi, which both target children undernourishment and give children resources to food to ensure that they are not undernourished. This program has yielded tangible and effective results. Going over to undernutrition, we see programs like the CDC high obesity programs in the United States and NHS digital weight management program in the United Kingdom, which have also yielded positive results by providing individuals with access to healthy food and physical activity in rural US counties, and by providing physical activity coaching and lifestyle support in the UK, respectively. It is safe to say that malnutrition is a huge issue that's going to be very hard to tackle. However, with these interventions in place, we are taking a step in the right direction. To recap, malnutrition is a spectrum ranging from undernutrition to overnutrition, and its effects can impact individuals negatively in a plethora of ways. However, with these public health initiatives, we are taking a step in the right direction and creating a better world for us to live in the future. Here are my references. Thank you so much for listening.